I'm Dr. Venkatesh. I'm a nephrologist. I want to discuss a couple of things. I want to give my view on this program, CliniEx, which is done by Reddy's for physicians. This program is a very useful one, and I want to share some of my views regarding this. Number one, the program is essentially for doctors, and it has got a very carefully designed program, which is based on what we call as the script running, or what we call as your normal diagnostic processes which we normally use on a bedside, like examination, history examination, collating that information, formulating a differential diagnosis. So this is an experiential learning. This experiential learning is kind of encapsulated by this CliniEx program. Therefore, we have a problem, and that problem is narrated as a story, and as a story is narrated, people tend to think about different possibilities in terms of diagnosis. Then you discuss this in a 2-to one-on-one basis with experts, who's usually they are the moderators, and they're usually a panelist in the program. And unlike other programs, this is more of a discussion rather than a didactic form of teaching, where somebody asks a question and somebody gives the answer. It's not like that. There's an active participation of us. So in real life situation, if you're encountering this kind of a problem, and these problems, these clinical problems that are taken up for discussion are generally very close to what we normally experience in our real life. And therefore, real decision making when it comes to how, in this kind of a situation, how would an expert would like to think about it, and in the given limitation, how people who work in a resource limited environment will be able to mount over that crisis, or think differently, or improvise so as to come to a diagnosis reasonably safely, and therefore proceed forward. These are the kind of some of the inputs that people can or derive in the CliniEx program. That is probably its most important strength. So this technique, what we call as the script concordance testing, where as to every doctor, we all know that the moment you see a patient, or they start saying these are the kind of symptoms I have, automatically a script runs in our head because of our training, because of our understanding of the disease process and everything. And this script automatically runs during this program in all our brain. We observe it, then we formulate our diagnosis, then an opportunity is given, or a discussion is open, where people start interacting with each other and try to formulate the diagnosis. So it serves multiple purposes. One, to understand your thinking process better, to reflect on it better, and then to borrow information from others in the real world situation. So if I have this limitation, I can't do this in this kind of a situation, what can I do better? So by discussing with experts, we can kind of reasonably understand. That is the strength of this program. Basically, it's so close to the way in which we normally think, and we think in an experiential way, and we learn in an experiential way. That's the beauty of this program. For example, this coming months, the first CliniEx program, after a brief interval of absence, which is going to come, is got interesting problems. I would like to tell you about one such problem, about a nephrology problem. A young woman comes to an hospital, found to have hypertension in the clinic. Doctor initiates her on medication, but within a matter of a year, she progressively deteriorates, her blood pressure increases, and she develops kidney failure, and so on, and her health takes a very negative turn. How to approach this? What went wrong? What could have been done better at the time of first visit? And how these things transformed into a more difficult situation later on can be easily thought of while the problem is narrated in a very sequential way, with all the evidences that are necessary to support the change in the health condition. And by discussing with the different experts, it's easier to understand and make sense of how to handle this problem in your day-to-day practice. And that's a very important strength of CliniEx. And I've been associated with CliniEx for a while, and we've been moderating quite a lot of these topics. It's been a joy. It's been a joy to listen to a lot of people, right from a general practitioner to an expert, and to varying levels of practitioners, the kind of questions that come up, especially in a practical situation when you're stuck and you do not know what to do about it because you don't have a certain specific tool, but then what can be done in that given kind of a situation. These kind of inputs, what we normally call trade, or what we call the tricks of the trade, where I would do something differently and why I do that differently and what is the evidence for that. That kind of a discussion is really enriching. I think people should participate or watch these programs more. And Redis is definitely doing a great job by bringing this program. And the revival of this program again after a brief period of absence is really a very welcome change.